You're listening to the Public Health Entrepreneurs Podcast with your host, Dr. Charlotte Huntley. Interdisciplinary approaches are essential to winning in public health right now, and I'm going to explain exactly why in this episode. Welcome to Public Health Entrepreneurs, the podcast for visionary leaders who are ready to transform public health and healthcare through innovation. I'm your host, Dr. Charlotte Huntley, and as a public health entrepreneur with over 25 years of experience in healthcare and in public health, I understand the unique challenges and opportunities that come with bridging multiple disciplines. Now, if you are an interdisciplinary professional, a high-functioning leader with expertise across different fields, then you are in the right place, especially for this episode. Now, here are 3 of the best reasons why interdisciplinary approaches are essential to winning in public health right now. My first reason, complex problems require complex solutions. Modern public health challenges like climate change, pandemics, chronic disease, health equity, and mental health are deeply interconnected with economics, technology, sociology, politics, and the environment. No single discipline can fully address these issues. Interdisciplinary collaboration allows for comprehensive systemic solutions. Here's my second reason. Equity demands diverse perspectives. To create equitable health policies and programs, we need insight from multiple communities and knowledge bases. Interdisciplinary teams, including experts in social work, anthropology, law, and data science, can identify blind spots and help ensure that interventions work across diverse populations. And my third reason why interdisciplinary approaches are essential to winning in public health right now is that better policy through broader understanding. So sound health policy is shaped not just by science, but also by law, economics, politics, and ethics. Interdisciplinary teams are better equipped to craft and advocate for effective, realistic policies that consider the broader societal context. Now, if you've been listening to this podcast for a while, you've been hearing me talk about your superpower as an interdisciplinary professional. You have your multiple disciplines, your multiple areas of expertise, and you often feel like, I don't know how to fit these together, and I keep talking about how there's power in this intersection. Well, let me share a story with you that poured fuel onto my points and my mission and everything that I've been saying for so long, especially in this very timely manner. So I moderated just recently, depending on when you're listening to this. So I moderated the American Public Health Association's Policy Action Institute in mid-June of 2025. So I'm putting into context because I'm not sure when you're actually listening to this episode. Multidisciplinary audience of professionals were present. They were brainstorming and collaborating and strategizing about how to solve some of the most pressing issues that are impacting public health. Now, to put into context, in case you happen to be listening to this episode in 2026, and who knows what the climate will be like and what things will be happening, this is in mid-2025. We are 6 months into this new presidential administration, and our country is just seemed to be turned inside out. Public health has been gutted out, and it's been such a devastating impact and journey for this first half of the year. So this conference was held in Washington, D.C., literally a day or two after the country led record-breaking protests against this presidential administration. No King's protests around the country. So the climate, the element, the nature of everything was vital. It was a very anxious time to be in DC, to be quite honest with you, right down the street from the Hill. And we're leading this conference and I'm moderating this event where we've got hundreds of people coming in from all over the country to discuss these topics in a very interdisciplinary group of people. Multiple disciplines were represented, and it was a very stressful time to be leading this type of a conference, to be there. So we're in a room, and like I said, there's big gaping holes across public health. CDC has been gutted out. So much has been removed in this attempt to erase and to minimize science. And so I'm just painting the picture to remind you of where the element of the time here. And, of course, For months on this podcast, I've been really niching down at the beginning of 2025, even before things got completely derailed, before things really started being dismissed and removed. I already started pivoting the content on this podcast to really encourage you to consider your superpower, your interdisciplinary background, your multiple disciplines, and think of it as a power and a strength and trying to encourage you to in that positioning. Okay. So now here we are at this conference and at this time that I've just described to you. So if you're listening to this episode as soon as it's released, all of this is fresh on your mind. But if you happen to be listening to this months later, who knows where we'll be and what's going to be pressing. I just want to make sure that we're in the right context here as I continue on with this episode. Okay. So we have an audience of multidisciplinary professionals in this interdisciplinary feeling because we're looking for the overlap. How can we fix these things? What can we do? So some examples, I mentioned to you the examples of some of the professionals in the room, but let me just reiterate that. We have policymakers, public health professionals, lawyers, educators, administrators. We had some nonprofit leaders, communication specialists, state representatives, legislators, advocates, faith leaders, medical doctors, nurses, and other healthcare professionals, all in this room together at this Policy Action Institute. And we are looking for ways to brainstorm and collaborate and strategize to solve some of our most pressing issues in public health that are impacting public health. So I was blown away at how many times I heard speaker after speaker after speaker stand on the stage and say some of the very same things you've heard me say on this podcast about the power of interdisciplinary collaboration, how we need to come to the table. Lawyers are advocating for public health professionals to come together and talking about the ways that we can work together to create effective policy. And even our state representatives, because as a moderator, I had a little bit of say in these questions to kind of sift out. So some of the questions I asked were, how can we help you, state representatives, do your job? Essentially, how can we help you to communicate to your colleagues who are maybe not understanding public health? What can we do to help you? Like, I wanted everyone in the room to feel like they had some sense of power and action and what they can do. Because you can listen to a panel of lawyers and legislators and policymakers and think, oh, that's great what you're doing. But how can I make a difference? How can I help? Okay. So I'm telling you all these things because at the same time I'm in this moment, I'm also kind of watching it happen. And I was in a very unique position because of my background and my ability to kind of see these opportunities. Like I say on every episode, I was able to, one of my strengths is this communication and fostering these great conversations. So I was able to make sure that everyone felt supported and we could sift out the pieces. So the leaders, these lawmakers and legislators are saying, this is what I need. And the people in the room are able to say, oh, well, I can do that, or I can do this. And we were actually networking and coming together. And it was a very powerful thing to watch. But at the same time, I kept thinking about all of you and everything that we talk about on this podcast. So I'm going to sum it up with some action items. Okay. So I want you to think, first of all, there's this strong call to action to have these interdisciplinary conversations, these multiple disciplines, professionals from these different disciplines to come to the table and have conversations and start to think about what we can do and talk about what we can do. We have to come together. Okay. So there's this big call for these interdisciplinary teams. At the same time, I'm thinking to myself, what about you as an individual? You become really aware of your interdisciplinary background because all of you listening to this podcast, I keep talking about how you often represent multiple disciplines. So all of these representatives of the different expertise in the room, a lot of you have multiple backgrounds that already overlap within your own library of experience, right? So when you all come to the table, that's like, amplified interdisciplinary power. So here are my strategic action items or action steps that I want you to really lean into and take away from what I'm sharing on this episode. So number one, the power of storytelling. I heard this over and over and over again. I say it all the time, but invest in developing and improving this skill. I've talked about it on this podcast in multiple episodes. I encourage you to invest in developing the skill or improving the skill if you feel like I'm good at that. There's always room for improvement. It is directly connected and positively related to the level of impact you're able to have. So your ability to tell your story, to explain, and because you can't say exactly the same thing, it won't land on different groups of people in the same way. Sometimes you have to tell a different version of your story, or you have to retell it in a different way to meet people where they are. And sometimes people will understand a more scientific approach, and sometimes they're going to need it to be a little bit more relatable into whatever context they need. And it's up to us to develop that skill of storytelling and how we explain it. And our ability to do this well is positively related to the level of impact that we are able to have. And this was reiterated over and over and over again. But for example, legislators talked about how when they want to advocate for whatever bill they're trying to pass, they do this by telling stories of the people. You can never forget that the data represents those people. So they tell stories of the people that are in the community that are impacted by the passing or not passing of this bill. So the storytelling, we just heard it over and over and over again, how powerful this is and how it is the most impactful. And that's what we, need to develop. So that's one power strategy action item for you, is remembering the power of storytelling and invest in developing and improving that skill. So number 2 is collaborate. Collaborate with other professionals to be a part of the interdisciplinary team. Now, this message came from several speakers, legislators, lawmakers, advocates. Literally being in that room was part of collaborating, because there was, by design, a lot of breakout sessions and opportunity to just hold, to kind of talk about what you can do. When I hosted one panel with a group of lawyers, there were 3 lawyers in the group, and 2 of the 3 specifically asked for public health professionals who can speak to certain topics, because they need these experts' voices to come together with part of policy that they're trying to drive. Because as the lawyer, they can't be the public health expert, but they need to bring the experts to partner with them. So they talked very clearly about the collaboration. So sometimes when you come together, they know your partners, your colleagues will know what they need. And sometimes you know what you need from someone else. So it's just a matter of collaborating with professionals and being a part of that interdisciplinary team. My 3rd power strategic action item for you is conversations. Have more of them. Be in the room or at the table when conversations are happening and participate. I'm a little biased because I'm all about the conversations, but I feel like that is almost like the superpower there. When you don't know what to do, where to start, or that's the most powerful thing, is having conversations, being in the room. Now that we are able to gather, you don't have to be at the huge conferences. Actually, there's a lot of power in the smaller, localized conferences when there's room for those conversations. Sometimes when you're at the large conferences where there's tens of thousands of people, it's those quick touch points, right? But when you're in a smaller setting, 1,000 or less, there's time for real conversation. The room that I was in had about 400 people, 300 or 400 people. I can't really remember the number. And then they had a lot of people joining online, but in the room, the way it was designed, it was perfect. That's my personal opinion there. But it was perfect because even as the moderator, I was super busy, but I had so many opportunities to be in conversations. Now I'm leading the conversations as moderator on the stage, but even in the room, around the tables and throughout the breakout sessions and interacting with people during meals, there was just so many opportunities to have the conversations. And you just have to have them. I focused a lot of time this summer kind of niching down to having more conversations, because that's where you can find out just kind of what's happening, where people are, what the need is. And especially when things feel very uncertain or unsure, always refer back to conversations, but never let go of the power of just being at the table in the room, and the problems that you kind of surface, brainstorming happens, partnerships are formed, awareness is heightened. There's a lot of power in those conversations. So make sure that you are in the room and at the table where these conversations are happening and participate in them. All right. And here is my 4th and final power strategic action item for you. And that is to conduct a self-audit. Explore your multiple disciplinary background and identify areas where your skill overlaps with public health. And you have multiple skills that overlap with public health, but take the time to explore your multidisciplinary background and bring this interdisciplinary awareness to the conversations you're having to attract more opportunities your way. It happens so easily. And to me, it's exciting to see, to be in those settings and to be reminded of just how easy it happens much more easily in those direct conversations with the right people than you would think. So conduct a self-audit so that you can explore. You have to be the one to identify your multiple, you look across your multiple disciplinary background and identify where your skills overlap with public health. That's something that you are responsible for doing. And if you're able to connect your own multiple disciplinary background first and then interconnect them, creating your own interdisciplinary strength, then you can walk into the room and sit at tables where interdisciplinary professionals are gathered together and brainstorm solutions in the most powerful way. It's the thing that breeds hope. It is the thing that gets us moving forward, and it feels like we're having some sense of making a change and having impact. I get excited when I consider this type of potential. It fosters hope for greater impact and a better future for all of the communities we serve. And you can probably hear this in my voice, right? But this is why I love focusing on supporting interdisciplinary professionals. Now, if you need help or guidance and support to help you apply the strategies that I've shared with you today. So if you're thinking, I've tried to do an audit, I think looking at my background, I think I know where I'm connecting here. But if you need some guidance and support in doing that, any of these strategies that I've shared with you today, maybe it's about how do I apply that to my story? How do I improve the storytelling? How do I network and find, go into rooms and join these conversations or be present at the table, or whatever it is that you feel, if you feel like you need some support, then in any of those things, then I invite you to work with me one-on-one. This is something that I can support you with as an interdisciplinary professional myself, and with that background, I understand these challenges and also how to optimize and customize the strategies or these strategic next steps for you. So if that's something that you need some support with, that's something that I can help you with. You can visit Public Health Entrepreneurs to learn more, and the links are also provided in the show notes. Just reach out to me and through the website or wherever you connect with me and say, I would like some help. I heard you talk about this on the podcast episode, and I'd like to really explore how to work with you. And we'll take it from there. My team is happy to help create an opportunity for us to meet and discuss next steps. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. Visit publichealthentrepreneurs.com to learn more.